Now that we have all our projections done, we'll go through the images and evaluate the criteria for each individual image. Starting with our AP projection of the knee, we have the entire knee shown without any rotation by evidence of the femoral condyles symmetric and the tibia intercondylar eminence centered. So condyles and our eminence are centered. We have slight superimposition of the fibular head from the tibia. The patella is completely superimposed on the femur, and we have an open femoral tibial joint space, equal width on both sides. Moving to the obliques of the knee, we have the internal rotation or the medial rotation, showing the tibia and fibula separated at their proximal articulation. The lateral condyles of the femur and tibia, both tibial plateaus are shown, and the margin of the patella is projected slightly beyond the medial side of the femoral condyle. Moving on to our lateral rotation or external oblique projection. Again, we have the medial femoral and tibial condyles, both tibial plateaus. The fibula is now superimposed over the lateral half of the tibia, and the margin of the patella is projected slightly beyond the lateral femoral condyle. Show it here. Again, we have a nice open knee joint. Moving to the lateral projection. We have our knee flexed 23 degrees in the true lateral position, as demonstrated by the femoral condyle superimposed on each other. This here. Our patella is in a lateral profile. We have an open patellofemoral joint, and open joint space between the femoral condyles and the tibia. Moving to our special projections, we have the Beclaire or the intercondylar projection, AP axial projection showing the intercondylar fossa. So we have a nice open intercondylar fossa here. The intercondylar eminence and knee joint space is visible here. No superimposition of the fossa by the apex of the patella, and no rotation as demonstrated by a slap tubular overlap. Moving down to our tangential projection using the Settegast method. The patella is in profile. We have a nice open patellar femoral articulation, open, and the femoral condyles and intercondylar sulcus is in profile as well.